recovering from a total knee replacement and wondering what exercises you can do to help with your recovery? Well, this video goes over the early phase of recovery, explaining what functional recovery is and identifying essential exercises you can do to achieve functional recovery. To start, functional recovery is the process of regaining or improving your ability to do everyday activities such as sitting, standing, and walking. Following a knee replacement, the two most important outcomes that define functional ability are knee range of motion and quadriceps muscle strength, as both are necessary for many everyday tasks. Despite the importance of range of motion and quadriceps muscle strength, following a knee replacement, it is common for people to experience limited range of motion in their knee, as well as a loss of muscle strength in their quadriceps. And so, exercises that focus on knee flexion, knee extension, quadriceps muscle strength, and functionality are recommended during the first 6 weeks after a knee replacement surgery. Check out my blog on the Curovate website to learn 6 safe and effective exercises you can do every day to achieve functional recovery.